We all understand the importance of mental health, yet most Canadians don't seek the support they need. Our leading digital innovations drive better outcomes for employers and employees by helping employees navigate what mental health care is available to them and find the solutions they need to get back to feeling their best faster. We also have a team of organizational health consultants who can work alongside you every step of the way. Learn more about Sun Life's commitment to mental health.
I definitely believe that providing flexible mental health support that fits an employee's unique needs can empower them, quite frankly, to take action and to take it earlier to improve their mental health and wellness. For example, as I mentioned earlier, some employees, they want to be private, so they may prefer the whole self-guided online sessions. Other people, they may want to talk to somebody, maybe even in person, maybe virtually. So it's critical to make it easy for all employees to have access to diverse benefit and wellness solutions whenever and wherever it suits them best. A couple of examples maybe are spending accounts. Whether it's a health spending account or a personal spending account, these types of accounts offer customization and can increase choice for employees. They can also provide a greater cost certainty for employers by allowing them to control how much money is placed in these accounts, as an idea. Some other mental health supports, such as larger maximums for mental health treatment. I think Mario mentioned it, employee and family assistance programs, digital health innovations. These are all programs that can be leveraged to support employers while they're trying to help their employees. And a very practical example, and I'm sure the other panelists can attest, many times we see caps on benefit plans for mental health, $500 a year, maybe $1,000, but it's combined with some other paramedical services. And the Canadian Psychological Association recommends a standalone maximum of somewhere between $3,500 to $4,000 per year just for mental health services. So a higher maximum would provide additional and often adequate treatment, which can improve the chances of returning to good mental health. And then probably finally, the need for virtual care, as I mentioned, is more important now than ever. Many Canadians prefer to engage with healthcare professionals virtually. And research shows that care can be delivered effectively over the phone or by video conference. So again, it's essential for people to have options so that they can decide how best to continue their therapeutic relationship.
I'll just add some. I think Lisa's bang on. She hit it right on the head. There's no question that I think some of the paramedical maximums that exist today are probably 30 or 40 years old. If you look at benefit maximums on different types of practitioners, anywhere in that 500 range or 350, 500, it still exists for the major or majority part of plans in 2021, which it's not changed, and I think it really needs to be changed. Whether it's adding healthcare spending account, as Lisa mentioned, or increasing some disciplines, not all, because we really got to look at the costs to benefit plans and how the claims would add up and then obviously cause rates to go up. But there is no question in my mind that some of what I would call non-elective paramedical disciplines should have much higher maximums because they only get used when there's a need to use them.
Well, I agree with this because I think the paramedical coverage that we have, we're going to see things like, chiropractic and massage come down and mental health go up. I think we're going to see the two of them pass each other. I think most people will think of paramedical as more of a physical thing when more people are struggling mentally than physically right now. And, the one thing too that I think is important is depending on the industry that you work in, you're looking at us doing stage, sound, lighting, and so on. It's generally more male dominated. And men, I think, historically have a harder time, reaching out and saying, hey, I've got this problem and I want to talk to somebody. So making sure, that whatever people need, it's discreet, and that, discretion is king here, where, people know that they can go and get the supports, and, they can come privately and ask. And this is a private issue for many that maybe feel too uncomfortable, come forward and say, look, I need this support. I need these benefits as part of my package of working here, because, I do need to speak to somebody. And just making sure that everybody knows it's very cliche, but it's okay not to be okay. And, that we provide those supports to those that typically wouldn't ask for them.